Our next presentation will be by Dr. Andy Gibson from Mission Rabies. And Dr. Gibson will be talking about both surveillance and vaccination progress in the Indian subcontinent. Dr. Gibson.
Thank you, Charles, and thank you, everyone. Let me just tee up my slides. So thank you very much to the organisers of the webinar for the invitation to speak today about our experience over the past 10 years developing strategies and methods for the control of canine rabies. I think we can all agree that there is a colossal challenge ahead, and this audacious goal of eliminating human rabies mediated by dogs by the year 2030. Rabies has a profound impact on the lives of so many people, and fantastic progress has been made over recent decades to innovate and develop better strategies to give access to post-exposure treatment. But that inevitably is going to leave inequalities in access to care, and people that can't access PEP because of finances or logistics or education. And so the only sustainable solution is to address the issue through veterinary strategies to eliminate rabies in the dog population. To do this across the remaining endemic parts of the world is going to require mass dog vaccination campaigns of a scale and complexity that the world has never seen before. And so this is really what Mission Rabies as a charity is trying to support. Mission Rabies was launched back in 2013 to explore approaches to rabies surveillance, mass dog vaccination, and mass awareness and education about rabies. And we've done that through building our own experience and understanding of these issues through a number of our own project sites working in partnership with governments and local organisations. From those projects, from implementing programs, we iteratively learn from experience. And for sure, the things we try often don't work out to begin with, and it's about adapting and evolving to find strategies that achieve that objective. And from now, we're really focused on improving access to the tools we've developed, our experience and the methods that we've used to other organisations to enable them to accelerate their own success. Much of my own time over the past years has been focused on the project site in Goa State in India, working in close partnership with the government of Goa and many other organisations to bring new focus to this issue of rabies at this particular project site, develop strategies and find ways to address the issue in Goa State, and using that really as a sandbox to then provide support to other governments. So trying to get into what are the practical field activities that have been done to really achieve progress. And in each of these areas of surveillance, vaccination and education is really not complicated. It's not hard. This is just a case of getting started for the most part and taking those first steps and just getting moving. So I'm going to go through the work we've done in Goa for each of these and then go on to talk about some of the other projects. So one of the early things we did on the surveillance side of things was establish a public rabies hotline, a central state number that was widely distributed and advertised to the public, to the government sector, veterinarians, healthcare professionals, anyone, that this is the phone number you call if there's a dog that looks like it might have rabies. When they get through to that number, they speak to a trained individual who screens the call and can give guidance based on what they've said. So that's kind of an educational exercise in itself, giving feedback and explaining what you should do and what's going to happen next. This phone number in Goa for the past 6 years has had around 73 calls per week. And a lot of those calls are inquiries about dog vaccination or a dog that needs treatment or a concern in the community that doesn't relate to rabies. But we do pick up the majority of the rabies cases we found through this public hotline. And so that central reporting channel is absolutely critical to rabies surveillance and using the eyes that are in the community to find those rabid dogs and get those data points on the map. From there, the next thing was to organise and build capacity for a coordinated response. So when a phone call comes through or from a bike clinic, a case that sounds like it's rabies, getting someone out into the field to examine the situation, assess the dog, speak to people in the community, and find out what the likelihood of rabies is in that case. And when the dog dies or is euthanized, then making sure that that dog is taken for testing at a central facility. We've also developed a mobile phone app called React that helps to coordinate that case investigation and supports the rabies surveillance officers in the field to conduct their investigation in a structured way, and also collecting the information about the case in a way that can be readily analysed and provided to the government to support their wider strategy. Finally, in the surveillance component, developing capacity for rabies diagnostics is absolutely critical, and ensuring that at the state level, there is an OIE gold standard diagnostic test available. And so in 2016, this was one of our core activities, was supporting the government to get a fluorescent microscope and the training needed into their veterinary diagnostic lab so that they could be doing rabies diagnosis in state as a routine thing. And this has been really under the leadership and drive of Dr. Gowrie Yele, who deserves the praise for much of the work on the surveillance aspect of it. Also thanks to NIMHANS for their support. And more recently, we've been working to bring viral sequencing capacity to Goa. And this has been a really exciting development using nanopore technology, again, with a large number of collaborators, but this is now in place in the Goa government state laboratory, running viral sequencing to understand the movement of virus, and when a case does occur in Goa, understanding where has that case come from, so that effective strategies can be put in place to again remove the virus from the state. On the vaccination side of things, back in 2014, we started developing mobile phone apps to help improve the coordination and direction of remote vaccination teams. This has been a core part of what we've been doing, is trying to improve the efficiency and efficacy of field vaccination work. Through the phone app, we can direct staff and teams vaccinators in a much more strategic and effective way, really trying to achieve herd immunity and homogeneous coverage across the region, leaving the virus nowhere to hide. So by 2016, this is what the work looked like. And over the next year, by 2017, we were up to 100,000 vaccinations across the state every year. The data that has provided through the phone app has also given great insight into the kinds of dogs that make up the dog population in the state, particularly understanding how dogs are kept, whether they're owned and confined, whether they're owned and allowed to roam on the streets, or stray without an owner and roaming all of the time. And this has particular relevance in designing a strategy to vaccinate these animals effectively. And there are very few options of how we can go about dog vaccination. There's Central Point, where you inform a community and advertise for people to bring their dogs for vaccination at a clinic. There's house to house or door to door, where vaccinators go house by house vaccinating dogs that can be held. And finally, capture, vaccinate, release, which involves a more intensive approach of using teams with nets to catch dogs in the streets and vaccinate dogs that otherwise can't be held for vaccination. The cost of these approaches and the logistical complexity increases as we go through. So dogs that can be held and brought to a clinic is preferable to a big team of net catchers going in and vaccinating with nets. And so depending on the composition of the dog population, we can design the most efficient vaccination strategy for that municipality or district or state. This is what the vaccinations over the last few months look like. And Goa in 2021 was made the first state in India to be given rabies controlled area status under Indian legislation, which is another fantastic step forward. Under that legislation, it gives the government of Goa additional authority to control the movement of dogs and to enforce certain aspects of rabies control in the state. And we're working with the government to better understand the movement of dogs at this border, as well as extending vaccination beyond Goa's borders, working closely with the government of Karnataka. And we're also about to begin vaccination in the north in partnership with the government of Maharashtra. And in this way, we're very confident that we can achieve canine rabies elimination in the coming year or so in Goa state. We're also exploring the potential use of oral vaccines to help improve the efficiency and reach of the vaccination programme. Awareness is obviously absolutely essential in making people understand the risk of rabies, making them aware of how they can support control efforts and engage with the programme, and what they should do if they are exposed or see a suspect rabid dog. Getting rabies into the school curriculum, so this is in the Goa state curriculum since a few years back, ensuring that children are taught about rabies as routine in their school curriculum. This is the impact in Goa state. So over the last 5 years, there hasn't been a single human death. So Goa has achieved human rabies elimination. And the picture on the dog side of things is also improving. So since 2014, when the state had rabies throughout most talukas, through to 2018 and 2019, cases are confined just to the northern area. We had a slight increase in 2020 and 2021 through the pandemic, but this year we've just had a single case up near the border, and we're continuing to support the government to expand their work into the surrounding areas and achieve canine rabies elimination. So over the last 10 years, this has at times felt like climbing a mountain, hand in hand with the Goa government and other partners. But just like when you're climbing a mountain, you get to the top and then you see what's beyond. And I think a lot of people look at the Goa project like this and say, well, Goa is a small state. It doesn't apply. It's irrelevant to the big problem, like its neighbor Karnataka, which has a population more than 30 times of Goa. And so what can we practically do to move this forward? And it's just like climbing that mountain. If you looked at the top and saw where you need to go, of course, you wouldn't even get started. Whereas if we just get started and start moving at the bottom there, soon we will find that progress is possible and we will be able to achieve that ultimate goal. So if we look at Karnataka state and start to unpick it a little bit, the population isn't even throughout, of course. In the cities, we have much higher dog densities, much higher human densities. And so let's look at those and what can be done there. In 2019, we were approached by the government of Bengaluru to come and support them and see how we could bring the success that's been achieved in rabies control in Goa and support them in their efforts. And so we're joining this journey partway through. The work in Bengaluru has been going on for several years, for decades even, with a huge number of partners that are active in this environment, and we're a small part of this picture. Bengaluru has a large human population, around 13 million people, so it's a big mega city in India. It has a very large roaming dog population. And must say huge thanks and recognition to Dr. Balaji, who's been our main point of contact in Bengaluru for the past 2 years, and really due to his ability to see the situation and adapt the experience and work and tools that we've developed so far and apply them in this setting, have we been able to support in any way. So it's really about trying to take those practical elements that I've talked about from Goa and trying to see how they could be put in place in other areas. Starting with that hotline number. So this was achieved in 2020 through CARE, which are an incredible local NGO under the leadership of Sudamam and with the help of UMA running the rabies helpline. So this was launched through BBMP, the local authority, in 2020, and has been very effective at coordinating the response to rabies cases. Going on then to the response, and we have supported with enabling a better coordination of getting into the field through these local providers of veterinary services who do a fantastic job to get out and respond to rabies cases, pick up those dogs and get them tested. And also Ajay Kumar, who is our rabies officer at CARE, who follows up and interviews people and sees how those that have been exposed can ensure they get the treatment needed. So this IBCM approach, again, being put into practice and really working incredibly well. And then also coordinating the post-mortem and testing of dogs. From a laboratory perspective, Bengaluru is incredibly fortunate to already have the OIE reference laboratory for rabies in place under the leadership of Dr. Islaw and his team at KVFSU. And so they've already got the gold standard diagnostic facilities in place there. Incredible stage tested, and indeed from across India. And so this is a fantastic base and foundation to build rabies control strategies in India. We've also taken the app technology that we developed through projects internationally and performed training to the teams in Bengaluru so that they can use that to track their vaccination efforts and direct them in the field. One of the first things was to carve up these working areas in each zone of the city to break those big regions into smaller working zones that could be used to coordinate vaccination teams. And so these veterinary providers have been working hard over the past 2 years to just get going with vaccination. And these show the month-by-month vaccination efforts in Bengaluru. So in 2020, they got started at the end of the year. And then through 2021, they really got going and scaled up vaccination intensively throughout the city, working zone by zone, vaccinating dogs throughout. And we're able to achieve over 100,000 vaccinations in the year of 2021. That work has continued through this year as they continue to vaccinate around the state. And so this is absolutely phenomenal. The city has achieved what it took us 5 years in Goa to achieve, they've done in 1 year. So it really shows what is possible in these metropolis settings. And so this is the areas that have been vaccinated today, the GPS location of every dog. And we can see that they've achieved really good coverage in all of the densely populated regions. One of the things that the app tries to ensure is that we don't get patchy coverage like this. So this is a hypothetical scenario where there are areas that haven't been vaccinated well. And in this setting, even if a government were to vaccinate like this for years and years and years, the virus would continue to circulate in these populations that haven't been vaccinated and just reintroduce. So you would never achieve that objective of rabies elimination. Whereas when we're using the app approach, we can direct teams to those specific zones. We can see where's been missed and send teams back to the area, boost coverage in that zone, and wipe the virus out very quickly. The city has already seen more than a halving of canine rabies cases in the city, so the progress is already being seen. And finally, on awareness, the Rotary Club of Bangalore are an incredibly active and successful group in communities, and so they're already beginning to look at ways that they can get this mass awareness and momentum behind the issue of rabies control. But then we again come to, this is the city of Bengaluru, and Karnataka is a very large state, and so we still have a long way to go beyond even the city. And so some of the work we're doing now is to look to understand the other factors that are at play in rabies transmission. And those include both population density, which we know plays a major role, but also in human connectedness and connectivity. And so trying to support governments to review what needs to be achieved and to target efforts to the places that are going to achieve greatest progress as quickly as possible. So identifying these high priority areas and building programs there over the coming years. To run a statewide campaign within the next 2 or 3 years is unthinkable, but to develop effective strategies in each of these cities would certainly be possible. And that's very much the approach that was taken in Latin America, and it could be very successful here, bringing these same things that we've been talking about. And so I hope that as polio elimination from India was a great success for human health and rinderpest elimination was a victory for animal health, the elimination of canine rabies would represent an absolute triumph for One Health. There are far too many people to thank, but special thanks to these people for committing to this issue of rabies control, to prioritizing it and making these efforts and progress possible. We're providing the tools and activities that we've developed through the International Rabies Task Force, so you can get in touch if you're looking to implement rabies control through this website. And of course, anyone doing any rabies control efforts should be in touch with the United Against Rabies Forum and engaging in that community. Thank you very much.
Excellent progress, Andy, and our hats are off to all of our colleagues in India. I was wondering if you might comment. We've seen a lot in the news recently coming out of Kerala, calling for killing of stray dogs, suggestion that there's mutations of the virus and the vaccines don't work, and calling for investigations. Based upon your experience there in Goa and surrounding region. Do you have any comments about the local situation there?
Obviously, it's incredibly sad, and it's a very difficult situation for the government to be trying to respond to in a kind of appropriate way. Obviously, culling of dogs has been shown many times over to be ineffective and not a successful strategy to deal with this problem. I think the government are actively engaging in looking at the science and the approaches to mass dog vaccination. And so, as I said in that talk, I think if similar approaches were implemented, they would be able to, over the coming years, dramatically reduce the canine rabies burden. But Kerala is an incredible state. They have a huge amount of resource. And so if I'm sure that's put to use in an effective way, then they will see progress very quickly.
Excellent. Bang on. Thanks again for all of your efforts out there.
Thank you.